going to go ahead and convene this Board of Health annual meeting and monthly meeting to order Wednesday, April 8th at 5 p.m. And could you roll, please?
Danielle Chenoweth.
Present.
Jennifer Locke. Present. Charlene Murray.
So we'll call the order, roll call. We have election of, chair and secretary. And because I will be traveling, I launched a book tour last week. I would like to ask to see if you would be willing to be chair.
I will only be here through the end of my county board term, which is only through the end of November.
Which
so
we could have.
I can do that, and
Okay.
until then, that's fine.
Okay.
Yeah.
I think it might be better, I'm looking at Mandy, who relies on the chair to move finances.
Yeah.
I would just say I will be present, but like I'm gone 1 week out of every month for the rest of the year. And last week was that week in April. So
So if it's the end of the year, then we can do a seamless handoff.
yeah, so we could look at that one. And then I would like to nominate Charlene and Abstentia for secretary. Because there are gonna be meetings where the secretary needs to sign.
I second that.
Okay. I have a motion and a second. Any discussion? I do want to say I'm planning my tour around the board meetings and the town board meetings, and I will be available remotely. Like, I only have Canada as going out of the country so far. Maybe I'll need to go personally. But yeah, so I just want to say I'm not expecting to be absent, but I think it would take some pressure off me with everything else. So yeah, I appreciate that.
No problem.
Okay. I'm still happy to meet and discuss. So, okay, so the chair and a secretary, any additional discussion? Okay, all those in favor say aye. Aye. Opposed? That carries. We don't need it, we didn't need a roll call with election. So election of the treasurer, I would like to nominate Ron Fields as our treasurer.
I second.
No
No
motion.
book tour for me this year.
What?
No book tour for me this year.
Okay, well, you can move to your next year. Okay, so that works for you, you accept your nomination, okay. Any discussion? I just want to say I appreciate the pithy summary is very clear information. I do read it every month, and although you're not in charge of expenses and income, we've done very well. We've managed public health very, very well during this time, and it's brought a lot of clarity to the board and peace of mind, so thank you for your service. Any other discussion? Okay, all those in favor say aye. Aye. Opposed? That carries. I will now adjourn the annual meeting. We can all breathe a sigh for relief. Next, okay, so next we have the monthly meeting agenda. I'd ask Amy to call us to roll call. I'm calling us to order. Amy, could you call the roll?
Danielle Chenoweth.
Present.
Jennifer Locke. Present. Charlene Murray.
Okay, so we have approval of the agenda. I would entertain a motion.
So moved.
Second, any discussion? All those in favor? Aye. Opposed? That carries. I'd entertain approval of the minutes of the previous meetings for March 11th, 2026.
So moved.
Second, any discussion or changes? All those in favor? Aye. Opposed? That carries. Do we have any public participation? Do we have any correspondence from our administrator?
Yes, just to inform the board that we are planning our annual strategic meeting, planning meeting tomorrow, and every 5 years after we conduct our health need assessment and community health improvement plan, the next step for us is to use that opportunity, that window of opportunity to review our goals and objectives and our value missions to make sure that they match the health priority of the health need assessment. So we are planning to do that tomorrow at the hotel.
Okay, I would know. Okay. And will there be action on the part of the board after that you expect?
Probably to share what we came up with or any changes, but no action needed for the
Okay, thank you. Any correspondence from board members? I just wanted to share with chocolate in my mouth that, at this point, we are intending to close the Armory shelter, the shelter, public winter emergency shelter. We got through the winter. We're seeing about 40 people in the shelter at this time. The high was 83. I do have some infographics that I can share at the next meeting that look at the data. I'm just double checking. They were just delivered to me yesterday. So I want to make sure that they're accurate before I share them. We served a little over 200 folks over the winter. We were never full. We had no turnaways during that time. It is unfortunate that we did have some turnaways of women, and we are looking to identify how to address that going forward. Strikes had some turnaways. We were trying to accommodate women with, through other means, but I think there was, with the change in leadership and communication, it wasn't always clear how women could become sheltered. I also want to say that the primary funding source for the winter emergency shelter for the last 3 years has been one-time funding. And I reached out to the state and was told that the winter bed initiative will not exist next year. So there was SMS money primarily for like immigrant response that was expanded for homeless services in the first 2 years, so for 2 years. And then this last year it was IDHS emergency transitional dollars through that I think were kind of like leftover money that was rolled over that hadn't been used by some agencies. So that money is gone. So I'm just telling everyone that situation, which is not great news. The good news is that with help from Public Health and Rosecrans, we submitted an application for the living room as Cunningham Township, and that would provide a 24/7, 365 drop-in space for people in a self-defined crisis that is entirely peer support-led, and is meant to help people kind of like work on and achieve emotional regulation and make some plans for how to deal with the crisis. So it's not a place that will have treatment on site, unless it's Narcan, obviously like some things like that, but there will more be like, it's a space for support, peer support, and assessment. We have not heard back whether or not we received that. I would say we have a really good chance of receiving that. It was a strong grant. We were the only one who applied, and we got support from both Public Health and Rosecrans, who used to have the grant. That is a 3-year grant, $1.4 million a year, because that's what you need to run a 24/7 space with 3 staff at a time. So that's good news, and that grant, you can have up to 16 beds on location. That is far different than the 80 or so beds. I mean, honestly, 80 was like 2 or 3 nights. Like mostly we were at 70 beds. It was very rare that we went over 70 beds. So it gives us a little bit of a sense of what's needed. I also want to say that we submitted, meaning Cunningham Township, submitted an application for rental assistance to the housing authority that was specifically designed to move folks from the winter emergency shelter, people with income, so Social Security income, hey Charlene, earned income, be able to move into housing, and it's like 8 months of rent to support them. So I mean, that what we're essentially pivoting towards at this point is helping. We have helped about 20 folks move into independent housing. We've helped another 25 folks reunify with friends and family, and we continue to work and provide case management to see if we can house the folks. And then we're working with Strides on if there are folks who are medically, like aren't really chronically homeless, who are not necessarily able to move into housing, to what extent can Strides take some folks who are there, although I know that they have their own plans for reducing their bed capacity. So we have seen an increase in street homelessness during this time frame. I do anticipate seeing another increase in street homelessness in April. That's all I have to report. I mean, I'm happy to answer questions. It's been a really strong partnership between different organizations, including public health. And so I'd like to continue to keep public health aware. Any questions? Charlene, we're on correspondence. Do you have any correspondence you'd like to share?
No correspondence, thank you.
Okay, if we don't have any other correspondence, I'm gonna move on to old business. We have a discussion of contract and lease agreement policy. So approval of contract and agreement signature authority policy, approval of contract and lease agreement policy, revised building space lease agreement policy. And I'm gonna go ahead and entertain a motion so we can discuss.
So moved.
So we have a motion and a second for approval of these and, sorry, I will second.
Oh, you were second.
Okay, now I'll second it. I didn't second it, so you are correct that it did not have a second. Okay, go ahead.
Yes, I hope that you all had time to review that policy. The idea is we had originally the first policy, which combined contract and lease agreement all together. So right now what we did, we divided that one policy into two. The first one is contract. We added agreement and MOU. For that specific contract, the idea is that, in contract, MOU and agreement need to be reviewed by the health administrator and then bring it to the board for approval, right? Like once the board approved, the administrator will sign. So that was not the policy before, so I just wanted to make sure. That's the new policy that we are submitting.
Yep.
So the second one is the lease agreement. So the lease agreement, previously, we just wanted to make sure that we have a few agency that rents our locations here at a really discounted rate. So we want to make sure that every year that we renew that lease agreement and see if there's anything that needs to be changed. Because you have to be a non-profit organization, so we don't know if organization status will change or not. We just want to make sure that we review that every year in order to rent our space to them. So those are the two agreements. If you have any questions, I'm happy to answer. But before it was specifically for the contract and contract agreement and MOU was no that.
Okay. So in the first, so thank you for that. I had a couple of questions. In the first one, these, I think we've needed this, so this is very helpful. It's a little bit unclear to me what it comes to the Board of Health. So it says may place, so is it up to the discretion of the administrator whether it's placed? Or are there things that absolutely come to the Board of Health?
So, at least, we can clarify this, this is just a proposal, we can clarify it in a more, clear legal term. So I think I submitted this to Ruth to look at it, but the idea is that sometimes different organizations that we have agreement with will request specifically the board chair.
Yes.
So if they request specifically the board chair,
Okay.
we'll bring it to the board chair. And one of the examples of that is the I-Plan, the states request that for the board chair to sign, so we'll bring it to the board to sign. So at least in my small amount of time here, that is one of the examples that I can think of.
Yep.
But I think in other agreements and contract need to be reviewed by the administrator and then also Ruth to make sure that if there's any legal binding things to review and send it back for them to correct those, and then we will bring that contract to the board and explain it to the board for approval.
Yes.
So if the board said, all right, let's send it back for readjustment or anything like that or changes, we'll do that and then bring it back again.
Yeah.
So once the board approve it fully, after I explain to the board
Yeah.
what the contracts entail, once you guys approve it, at the end, I will sign it. So
Yeah.
that is what I'm proposing.
Okay.
So we can really like the term, I just feel like there is an urgency to do that. I know that there is a
Yeah.
background behind this for the former
Yeah.
public health administrator who was here before
Yeah.
Julie. There was a safeguard to make sure that things are looked over by the board and signed.
Yeah.
But right now, we have seen some, challenges with that. And I just want to make sure that you guys review this and really add any input to it. And if you're good with that, we'll make sure that it's a step process. So I have a meeting with Rue every Wednesday from 5 to 6 every Wednesday to review all the grants, contracts, MOUs. That, if there's any legally binding terms, I would wait until she gives me
Yeah.
otherwise her approval.
Yeah.
And once she gives me her approval, we'll bring it to the board for
Yeah.
final approval.
Yeah.
So once the board approves, I will sign it.
Yeah.
And then
Yeah.
we'll fully execute those contracts. So that's the
I think, we need this proposal. It adds clarity and definition. The step-by-step process makes sense. I have two concerns about it when looking at it, which I only got to look at it this afternoon. I would call, I usually if I'll call, but I have not had time.
Yes.
Which is, Board of Health signature will be required only when mandated by the statute, regulation, funding agency, or the requirements of the other party, or parties to the agreement. So my concern, I'm kind of looking at you, Ruth, is there are times when the other party does not deem that it needs to go to Board of Health, but we would think, yeah, the other party may have not put a signature line, but this is something that, as a Board of Health, we think is serious enough that should come to us. So I'm a little bit concerned about being like, oh, we leave it to the other entity and we just have the oversight that they want. That's a concern to me. And then the second is, you say, number one, for review prior to being placed on the Board of Health agenda, as though it's going to be, but then later it says the public health administrator may. I think the clarity comes in saying the Board of Health signatures are only required when, so I feel like that clarifies that. I think the question I would have for the board, is what should come to us that may not be mandated. I absolutely think that there's certain things that, so a document that binds the district financially or legally, that should come to the board, whether someone else thinks that it should happen or not. That should go, I think leases should all come to the board. I think that, but then there's things like service agreements, which is actually different than a contract. A service agreement is like, you have a janitorial service agreement that's under a certain amount of threshold. Like maybe that doesn't need to come. If someone wants a letter of support, a letter of intent, these kind of things that actually don't legally bind us, it just shows that we're interested, I don't need to come to the board. So my concern with the way it's written now is it doesn't actually articulate our stance on what should come to the board and what shouldn't. And that would be what I would want to clarify, but I think that that's the only thing that's missing from this, is just some clarity around that piece. And then it's super clear to you, oh, well, even though there's not a signature line for the board, this is a lease agreement. And that's something that the board has said, we want to be involved in lease agreements.
Okay.
Or we want to be involved in lease agreements over $1,000 that are, that are 12 months or longer. I guess I just think it would be useful for us to be a little bit clearer, and I wonder if you all had some conversations around that.
Yeah.
I just want to say that everything is coming to the board, but not for signature, for approval. Does that?
Right, so I think, the idea is this comes, board approves it, board
Yes.
approves, and board approves administrator signing. So
Okay. So could we just say instead of may, say shall? That would fix it, if that's what you
Yes.
intended. It's just number 3, and I'm sorry to cut you off, I just.
Right, no, I think that makes sense to make it
Just
clear.
say shall, then I'm not confused anymore.
Right, after legal review when required, so if legal review is required, but otherwise, the public health administrator shall place the agreement on the Board of Health agenda for approval. And
I
so
see.
I think the idea, and I think what we talked about was, that the board, all in favor of entering into this agreement, aye, those opposed, no. That doesn't require a signature, but then Mamadou has the authority then, because the board has approved it, to then go ahead and to sign the document and enter into that agreement, because it's not just what he believes, which is
Okay.
why he's bringing it to you with a suggestion for approval, but in that you all have taken your review of it and your responsibility and agree.
Okay.
But, so yeah, I think that makes sense to just add that, or change that may to shall in paragraph 3.
Okay, I think I'm understanding the difference between approval and signature. And I guess what wouldn't come to the board, is it clear enough what doesn't come to the board? Because honestly, like letters of support, we don't need that to come to the board.
Yeah.
And I think that there's certain kind of service agreements, especially because we're doing a equity
Yeah.
frame, makes sense. And we could always change this and tear off some things that are clear if you want to move forward with this, because this then is all encompassing, so to speak.
Yeah, I think we wanted to make sure that this is a holistic list.
Okay.
I think, if you look at the bullet, right, grants and grants application,
Yeah.
contract and service agreement, we listed everything needs
Yes.
to come for the board approval.
Yeah, and for the administrator
Yeah,
is the
the
other piece.
administrator will review it, and then the administrator will present to the board and explain what the agreement or MOU entail.
Yeah.
And then the board, after final approval from the board, if there's any legal, term or anything, it would go to group to review, and then when the board gives their final approval, I will sign it, and then we'll
Yep.
you guys just keep that agreement going. So that's the idea.
Mhm.
But we really I feel like we need to do this as soon as possible. This is just my feeling about this. You can take time and review it. I'm fine with that, and then we just need to start doing this process.
Yep.
So my thoughts
Mhm.
are that, if this is, basically you're a funnel. Everything comes to you, you funnel it to us, and you're only signing if we say yes.
Yes.
So that was my take on reading it, so I'm fine with it, but if Daniel wants more time, I'm also fine with putting it off next month.
Can I make one of them? So I'm fine with as long as shall, may become shall. The other change I wanted to recommend that is in line with how we've done emergency situations,
Mhm.
which are important because you
Yeah.
don't know when a pandemic's gonna happen, but could be not.
Mhm.
So number 6, I think it should say, I'd like to add one piece, which is in such emergency, so it's that emergency situation.
Yes.
There may be rare circumstance in which an agreement must be executed immediately and cannot wait for the next scheduled board meeting. In such emergency situations, the public health administrator is authorized to sign the agreement without prior board approval in consultation with the board president. That's what has
In
kind of
consultation, we
happened.
have-
So
yeah.
what that means is it's a phone call, it doesn't have to be
Mhm.
recorded on email, but it's the understanding. And I like policies like that to assume worst case scenario. You leave, all of you leave, there's some holy terror who's the head of administration, and there needs to be some check. That's what I'm thinking. So that is how Julie and I always ran it, and I feel like I was able, or Andy, but for a long time it was me, to ask questions or say like, hey, is there this other approach, I felt like the decisions were better because we had that conversation.
Yeah, I completely agree.
Okay,
That would-
so
that
in
change.
consultation
with-
consultation with the board president,
Yeah.
and that way it's one phone call and
Yeah.
sometimes those phone calls were like 11 o'clock at
I
night,
know.
once, but when they all maxed out on their credit cards and everyone's like, should we let employees use their credit cards to put people in hotels? I got that call. And I said, well, how much money are we spending on hotels? About $100,000. So why aren't the hotels billing us? They're refusing. I said, tell them we'll take our business elsewhere if they do not bill us, because people should not be having to put it on their private credit cards. So phone call to the hotel. Hotel was absolutely ready to invoice us as a government agency for hotels. The employees did not have to put it on their credit card. That's an example of how I felt like, and I was like at 11 o'clock at night. We maxed out on our credit card limit because the pandemic was so crazy. So, I mean, I think things like that could be helpful.
I completely agree with that change, we'll make that change.
Okay,
Yeah.
so I would move approval, I would make an amendment to, on number 3, turn may to shall, and on number 6, at the end of the second sentence, add in consultation with the board president. That is my amendment.
I second that amendment.
A motion and a second. Any discussion on the amendment? Okay, all those in favor of the amendment say aye.
Aye.
Opposed, that carries. Now we're on the main motion, amended. Does anyone have any discussion on the main motion that is amended? Okay, all those in favor, oh, I'm sorry, hold on. Because we moved it omnibus, I want to just make a comment on the second one, building space leads. I think this is really important. I'm glad that we're doing it. I just want to flag that just because an entity is a nonprofit or government entity doesn't mean that it's tax exempt. I'm not a tax lawyer, but I play one on television, and I've done this a lot, which is that like it has to be charitable ownership, which of course we are, and charitable use. And I think, but I do believe that the verification is important because we have nonprofits who get out of good standing with the state, and it's very easy to pull the Secretary of State piece. So I think that that's a very good idea. I just want to flag for us that as we move into leases, charitable use is an important litmus. We don't have to write it into here that it has to be a charitable use, but we should be prepared to, if our property tax status changes for that section, then what you can do is write into the lease that if taxes are owed on that property, the leaseholder shall be responsible for the taxes. So I just want to mention that any new leases should really include that, because otherwise we're underwater and we're actually getting less money from the lease than we might be paying out. And you never know what the Board of Review is going to do, and even if the Board of Review agrees with you, the state might not. I've had that situation before, and so you actually don't know. It's a little bit of a crapshoot, and so that covers us with anyone who's leasing. So I'm fine with the language, but I wanted to make that comment.
Yeah.
Any other comments about the contract and lease agreement policy before we take a final vote? Okay. All those in favor say aye. Aye. Opposed, that carries. Okay, next we have the treasurer's report. Ron?
Yeah, as of the end of February 2026, we were showing the balance sheet with cash on hand of $7,481,598. Our total fund balance was $7,761,537, representing 42% of the budgeted expenditures for the year. We ended the 8th fiscal month with a deficit of $778,539, but that was only about half of the budgeted deficit that we had of $1.5 million. Total annual budget just over $18.2 million has remained the same. Income statement, we show total revenue of $9,825,539, which is $1.2 million under the year-to-date budget. Our property taxes are just slightly under budget with $127,000. Grants and contracts under the year-to-date budget of $972,000. Fee for services under their year-to-date budget by $221,000. Other revenue was over their year-to-date budget by $88,000. Our total expenditures for that first 8 months was $10,604,079. We're just under $2 million under the budgeted for the year-to-date fiscal year. mostly made up of personnel being under budget by $532,000, fringe benefits by $322,000, contractual services under budget by $577,000, and patient care under the year-to-date budget by $156,000.
Great, thank you. Any questions from? Okay, two quick questions. One is, grants contracts being under budget by $1 million, and then personnel being under by $500,000. We have an explanation of that.
So the grants and hours is quite a bit under. No specific reason, it's just the timing of things. Personnel is usually turnover, because I budget for the end, everybody to be fully here at 100%.
Okay.
We have enough turnover that it
Okay.
take that out, we're under budget.
So it's not like we had some big loss of a grant
No.
that we're aware of, like something that we're used to receiving. Yeah,
Yeah, I mean, as of right now, we are receiving all of our grants, and some of them even have increased, so.
Okay. Yeah, and in terms of like where our income is under, our expenses are much further under than our income, so it's a healthy situation. It's just, I'm curious if we lost something. I would entertain a motion to put the treasurer's report on file. So moved. A motion, I can second it. Any discussion? All those in favor? Aye. Opposed? That carries. Next, we have approval of payments to the Board of Health appointees to Treasurer Ron Fields for March 2026 services and Attorney Ruth Wyman for legal services from February 16th through March 13th of this year. Are there any questions about those payments? If not, I'd entertain a motion. So moved. A motion, I'll second it. Any discussion?
I just wanted to thank Ruth for her willingness to, for late work hour with CUPHD, so I really appreciate that. I think in the last, 2 weeks, we have been very successful at reviewing things really well and have a clear line of communications and streamlined processes, so I'm very happy and grateful for that. I just want to report that to the board.
We've essentially set up every Wednesday, except the monthly meeting Wednesday, to talk at 5 o'clock by Zoom, just to go over any emails, issues, that sort of thing, contracts, anything like that. And I think Mamadou has also suggested if other staff have questions, so we can all join in just by Zoom to take care of that, just so things don't hopefully fall through the cracks. And yeah, so far it feels like it's working well. So, thank you.
Thank you to the use of expenditures.
I'm sorry?
I said it's a good use of expenditures. It is, I mean, having regular legal review at this, at an organization this size, I'm glad it's been regularized. Any other comments? If not, all those in favor say aye. Aye. Opposed, that carries. Next, we have a review of the credit card statements. Any questions with the credit card statements? If not, I'd entertain a motion to put them on file. So moved. But second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of an engagement letter for fiscal year 26 to fiscal year 30 for Gatsby 75 actuarial services with Menard Consulting Incorporated. And I'll also take omnibus approval of engagement letter for fiscal year 26 to fiscal year 30 audit services with Lauterbach and Ammon.
So moved on both.
Motion, any second? And second it, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, motion to review and approve proposals for fiscal year 26 meeting campaign to reduce young adults' use of electronic cigarettes. I'd entertain a motion. So moved. Second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of revised agreement with Jose Vasquez, artist and CUPHD for the MCH entryway artwork. I'd entertain a motion. So moved. a motion and a second, any discussion? Hold on, I'm trying to, there were so many.
It's just extended.
Oh, it extends the deadline, okay, cool, I was trying to get to that, there's a lot of audit things, okay. So extending the deadline by 1 month, great, so it's the same as we said before, I see. We have a motion and a second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of a clinical education affiliation agreement between the Board of Trustees of Eastern Illinois University and CUPHD. I'd entertain a motion.
So moved. Do we need to do this on the bus with all three of them?
Sure, actually, it looks like, yeah, I was looking if we could do 11. Okay, so, so in addition to number 8, which I've already read, I will add omnibus fashion approval of a contract agreement between CUPHD and Carl Foundation Hospital for East Central Illinois HIV Care Connect services from April 1st, 2026 to March 31st, 2027. And then also approval of contract between CUPHD and Carl Health Medical Group for East Central Illinois HIV Care Connect services from April 1st, 2026 to March 31st, 2027. And also approval of contract between CUPHD and Carl Richland Memorial Hospital for East Central Illinois HIV Care Connect services from April 1st, 2026 to March 31st, 2027. I'd entertain a omnibus motion for those 4.
So moved.
Motion, I'll second it. Any discussion of any of them?
Can I
Yes, please.
go back to number 6? I just remember that the proposal the criteria sheet that we have for going through building contractors and other building related issues that we have here for constructions. The criteria was a suggestion from the board, right? And for this specifically, number 6, the proposal for media campaign to reduce young adult use of e-cigarette, I think that's a grant money. So we had a really hard time to match, to go through that proposal. Because it was a grant money and we, share or posted the bid on our website. So several companies applied for the bid, and we tried to go through that same process that we have for the building contracts. So it did not match really well because it didn't include grants related items. Does that make sense? Yes.
So, yeah, when I saw the bid score,
Yeah.
I was like, oh, well, what were we deviating? Then I saw, oh,
Yeah.
the bid was double what our budget is, and so
Yes.
we can't use grant money that way.
Yes.
So, yeah, I think that's not necessarily a one-to-one when it's
Yes.
a grant, and
Yes.
so we might need to look at that.
Yeah, we were like, okay, this is not working, but we really, we have 3 discussions.
Yeah.
And I really wanna, thank, our division director to be very flexible in that, because it's very painful to go through this process and how to readjust. So I guess one of the things that we come to agreement with, after we play all those scenarios, we went through with a contractor based on, based on the criteria sheet, but also based on the fact that they're not over the budget.
Yes.
And
Yeah.
then our experience.
Yes.
With
Surplus
that.
50 limit,
Yes,
or-
yeah.
Yeah.
So, but we want to make sure that the criteria include, criteria includes specifically grant-related items. Because right now, what is listed is just based on CUPHD's funds. So we want to make sure that the criteria list at least some component of grants, so that it allow, clarity. For example, we understand why we choose this,
Yes.
but if we share the score
Yeah.
to
Yeah.
the contractor, it would be difficult.
So do we need to make changes to the process?
The
So,
credit.
yeah.
I would suggest, I saw that we went with Surface 51, I saw the pricing of insane
Yeah.
pricing, and what I think might be needed is kind of like a veto basically like, let's say, you received really poor recommendations, so they're the lowest, it's minority, it's
Yeah,
Plymouth,
yeah,
it's
yeah.
Houston, it's Champaign, but you have two people who are like, they will rob you
I
blind.
know.
Then you have to be able to veto. The same thing with price, and I would say it's not only for grant funded things.
Okay.
Like, it's our money, it's public health money, and if we're seeing something that is outside of a range of reasonableness in terms of price, I think the staff making a recommendation, this is exactly what I would want.
Mhm.
Here's the summary proposals,
Mhm.
here's the cost, here's the bid score, here's all the bids. We, staff are making a recommendation of this, which we, and your justification, which I think was perfect. Like, I don't think we need any, honestly, this was very helpful.
Okay.
And I had no concerns, and it was very clear why you chose.
Mhm.
So, if we need clarification on the language, that staff will make will provide all these, but staff can still make a recommendation, and then we can choose a different one. Or, we could go back and forth, and we may end up choosing a different one. I doubt very seriously that would happen.
Yeah.
But it may happen sometimes, and we should be, we're different bodies, right?
Yeah.
Who might have slightly
Yeah.
different interests. So, I saw this and I had no problem with the
Yeah.
process, and I felt like you all did the right thing.
Okay.
It was the most reasonable.
Yeah.
Oh,
The
yeah.
one, yeah, so we're,
Perfect.
And it's 15, it's
Yeah.
local,
Because the
we have
issue-
experience with them.
Yeah, the issue that arose was that, the 200K was,
Oh, it's
oh, that was
Yeah.
absolutely.
but
something, no.
it's about, we determined, but I just wanna make sure that, if you
Yes.
have any input, since the
Yeah.
criteria sheet, idea came from you guys, if you have
Yes.
anything, we do not really wanna take in that, just complying with it.
Yes.
So we
Yeah.
just wanna make sure that,
Yeah.
that's clear, so
Yeah.
I wanted to bring
If
that up.
if you see the opportunity to bring language changes that look at like, staff will weigh the bidding score and make a recommendation looking at the totality of the case.
Mhm.
And provide the board the documentation.
Mhm.
I don't see, the board will make the final decision.
Yes.
And that's pretty clear in our proposal as it is, but we're happy to have you all make recommendations. You work with folks in the community and you have context, So, okay, so that was 6, we'd already voted on it, we understand why. We have an omnibus, motion before us for 8 to 11. Is there any discussion on the omnibus? Okay, all those in favor say aye. Aye. Opposed, that carries. Next, we have approval of bid for Servview for commercial freezers, fridge for the free markets.
It's in a separate. Yeah, we have a different sheet, the bid sheet.
Oh, okay. Oh, okay. I did
Send
not
it
see,
an
yeah.
updated
Okay.
story sheet.
Okay. So let me just real quick, who sent it?
I think it was Amy.
It's on top of your pile there too.
Okay. Oh, is it? Oh, thank you. Okay. That's helpful, because I'm like, go hunting. Look real quick. Yeah, no, it's right here, but, okay, so the proposal, sorry, I was in 2 different, I keep 2 versions of it open and I've lost. Okay, so the, 326. Okay, I'm back online. All right, so the proposal is to approve the bid from Servview and Servco, okay, so 17, we got it, 20, so it's the lowest bid and the highest score. Okay. I'm sorry, did I ask for a motion in a second already? Okay, I'd like to make a motion to approve the bid for Servview for commercial freezers, fridge for the free markets. Entertain motion?
Motion?
Second? Okay, any discussion? All those in favor say aye. Aye. opposed, that carries. Next, we have approval of professional services agreement with Family First Advocacy, not-for-profit for the Community Network Anchor Grant. I'd entertain a motion.
So moved.
No motion, second, any discussion? All those in favor say aye. Aye, opposed, that carries. Next, we have approval for check request payable to Surface 51 for digital campaign to increase access to fentanyl test strips, CS Construction Group LLC for refugee doorbell, and Circa for annual job postings in advance belonging and inclusion module. Entertain a motion.
So moved.
And second, we have a motion and a second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of requisition payable to serve you for commercial freezers and fridge. Entertain a motion.
So moved.
Second.
We have a motion and a second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Next, we have approval of expenses payable to Amanda Knight for March 26 travel expense and GMA annual grants training. I'd entertain a motion.
So moved.
We have a motion and a second. This is the forecasters. Got it, see it. 34. What's it, I'm just looking for the total amount. 5,065.14, that includes the, conference fee. Oh, okay, for multiple people to
Yes,
attend.
I think it
Got
was
it.
for 4 or 5.
Got it, okay. I have a motion and a second. A little slow. Okay, I'd entertain a motion.
So moved.
Okay, a motion and a second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have pending grant contracts for the administrator to sign. Are there any? Okay, so none. And so our next monthly meeting will be May 13th at 5 p.m. and we are adjourned before 6 o'clock. Yes. Yep.